Hi everyone, I'm Farah Siddiqui, one of the Basic Course co-directors. Welcome to Basic 2025. And if you haven't made up your mind, maybe this presentation will help. So Basic Course, the pre-work will start this year on June 10th, and then the live course will be live streamed virtually, and then of course in Park City, Utah, starting Thursday, July 10th, and going on till July 12th. So we really hope to see you there, and we hope that you will participate in the pre-work ahead of the course to give you the strongest experience. So what is the pre-work all about? The pre-work will go over some introductory topics and then some more detailed lectures about allergy testing, treatment for allergy, and then some short talks on more advanced topics such as food allergies, asthma, and billing and coding. So if you already have experience with allergy, perhaps you can just peruse through the introductory topics. But if you really want to gain from the basic course, I do recommend that you go over some of the more nitty-gritty details in the allergy testing and treatment topics so that you can have the best building of your concepts during the course itself. Thank you to our wonderful, dedicated faculty that has come up with all of these very, very insightful pre-work lectures. So if you go through pre-work, you will get a lot of your questions answered, and you may actually come up with more questions, which we can help you with during the course itself. So from the pre-work, you basically want to develop some concepts on exactly what the immunology behind allergy is, how you can test patients, skin testing versus in vitro testing, which patients should be tested in vitro versus skin, how you can use those results to create immunotherapy plans for your patients, and when immunotherapy is the right decision, sublingual versus subcutaneous immunotherapy, how to create your vials, how to start the treatment, how to stop the treatment, how to deal with emergencies, and then, of course, the more medical treatment of allergy with pharmacotherapy, as well as with environmental control and avoidance, will be discussed. How to start your allergy practice is a very important topic that we will go over both in the pre-work as well as the life course. So if you've never built your allergy practice, this course is the perfect venue to start planning, to ask questions, and to really understand what it involves. If you already have a practice but would like to improve how it its efficiency, how the staff are being trained, how to retain your staff as well. All of these topics will be covered in the actual course as well as the pre-work. So the introductory topics, again, you can go through these quickly. If you've never done allergy before, then I do really recommend that you go through these, take your time at your own pace. The pre-work will be available on June 10th and will still be available to you up till September 15th this year. And of course, if you have any questions on topics or if you have trouble making it to this course, you can also look at the educational stacks that AAOA will open up once the course offerings are finished after September 15th. Then the pre-work will go over allergy testing. And again, this is the meat of the pre-work as well as the actual live course, along with the immunotherapy options and how to actually make your vials. I would really recommend going through the treatment section, especially on subcutaneous sublingual immunotherapy, before you come in for the dose calculations vials during the actual course, because that will allow you to understand things better and actually learn more from the practicum. Asthma, food allergies, billing and coding will be talked about as well during the course. Once you have learned about the basics and framed the concepts, we will go on to the live course starting July 10th. And these are our wonderful, dedicated, motivated faculty. I will be there too. We will be there to answer your questions, to teach, and to learn from you. On Thursday, the course starts late and we go over some introductory topics. And we will also start talking about how to add allergy to your practice. Then on Friday, we have the whole day, and this will be an intense day. We will talk about allergens, what to include in your testing panels, how to do skin testing, what different modes of skin testing, the skin testing practicum, how to do in vitro testing and when to do it, how to interpret it, all of the allergy tests, and use them to treat a patient, whether medically, whether through immunotherapy. All of these topics will be discussed, and how to set up your office, how to set up your practice, how to deal with allergy emergencies. Because obviously, if you will be doing testing and immunotherapy, you may have to deal with an allergy emergency or two. How to prevent them from happening, of course, is also an important concept. On Saturday, we will go over how to actually make treatment vials for both subcutaneous sublingual immunotherapy and also some more information about subcutaneous versus sublingual immunotherapy. Again, going through the pre-work will really help you out in the dose calculations practicum. If you don't have the time, you will still learn, and we will walk you through, the faculty will walk you through the worksheets. And of course, the pre-work is available to you after the course as well. Every day of the live course, you will have opportunity to ask your questions through the Huva platform. And then we will always have a venue at the end of the day to go over questions as well, whether it's networking with us, whether it's an actual Q&A session. So you will get your questions answered, and definitely ask all your questions about allergy management, testing, immunotherapy, your practice, billing and coding, challenging patients. We want to help you with all of those concepts and more. Not only will you get your questions answered, but the basic course is the perfect opportunity to network, to create more contacts. And if you're interested in becoming a fellow of the AAOA, which I highly recommend, and even residents can start this process, then the basic course is going to give you an educational opportunity towards completing your fellow exam and becoming a fellow. So welcome everyone. We really hope to see you at both the pre-work as well as the life course, whether online or in person in Utah.